The following segment is sponsored by Oakview Medical Associates.
Welcome back to the Morning News at 10 a.m. It's Tuesday, and that means we have the pleasure of sitting down with Dr. Nita Bijoor from Oakview Medical Associates. Good morning to you.
Good morning. Thank you for having me again.
Absolutely. We always look forward to it. You're board certified in family medicine and lifestyle medicine, and you're extremely well versed in the diabetes epidemic. Talk to us about what you're seeing.
You know, diabetes is probably one of our biggest healthcare crises right now, and a lot of us don't know, but there are several different types of diabetes. The common ones we know of are type 1 diabetes, which is where your pancreas just doesn't make enough insulin, it shuts down, typically seen in the younger population. Type 2 diabetes, which almost 100 million people will have by 2050, is the main healthcare epidemic right now, where your body has enough insulin, but it just cannot keep up with the glucose load, with the amount of processed foods and the calories that we're consuming.
And that's the root of the problem. You say calorie consumption is a real indicator of what's happening. What are we consuming?
So currently the US calorie consumption a day, 63% of our daily calories come from processed foods. 25% comes from meat, eggs, and dairy. And only 12% comes from vegetables. And out of that, 6% is processed veggies and fruits like candied apples and candied almonds. 6% is actually whole vegetables, fruits, legumes, nuts, grains, and seeds. So we need to do better, not just 6%.
What should we be aiming for realistically?
You know, honestly, I think if we can get at least a majority of our plate to consist of veggies, legumes, lentils, like I aired last time, fruits and whole grains, and then keep the processed foods, avoid that or keep it to an absolute minimum. And there's another concept that I really like to introduce, which is calorie density and nutrient density. So most of us eat foods and go, oh, this is high in calories, let me not eat this. But if it is nutrient dense, if it has all the vitamins, minerals, and it's enriched with all of that, then it's some food to be considered because it's processed differently in your body.
It's worth putting in there. It's a good fuel. Yeah. Having a sweet tooth is certainly contributing to the problem. What's been happening to our sugar intake?
Okay, so I did some research, and this is shocking. Americans nowadays, compared to 100 years ago, we're eating 80 pounds more of sugar, 70 pounds a year more of oil, and 25 pounds more in terms of cheese. And our television hours have gone up by 4 hours a day. Of course, we love watching Fox Carolina, but television has gone
Everything
up.
in moderation, right? And let's talk lifestyle. Lifestyle, you say, is the cause and the cure for type 2 diabetes and other diseases.
You know, it's at the core. So just incorporating simple nutritional habits into your schedule. I was talking to someone the other day, and he's lost 50 pounds over 6 months just by sensible eating, and that's so empowering. I want to use that as an example because that's a young individual that could have done nothing and just eaten out 5 days a week, but he consciously chose to make these decisions, and losing 50 pounds looks great, feels great, is able to exercise, sleeps better, doing better at work. It's just a win-win. So.
And I'm sure once somebody starts to see that success, they start to see that weight loss and that better health, they're hooked.
Yes. I mean, medications do work to control numbers. They have not done much to reduce deaths or reduce hospitalizations. That is why working with your physician hand in hand to not just be on the right medications, but also have this very supportive environment. At our practice, we really focus on making sure we give our patients that support, which is lacking.
And that's what I wanted to talk about next, the environment at your practice. You even have a gym right on premises at Oakview Medical Associates. Tell us about that. Tell us about your approach.
Ever since I started my practice about 12 years ago, I had the vision of having a place where our patients can come with whatever condition they're dealing with and really focus on different aspects. So we've introduced a gym, which is one of a kind. We have an awesome personal trainer. We're adding another one. And just very, in a very non-judgmental way, getting them to start moving, start recognizing the impact. And we take blood pressure sometimes before and after the visits, and there's a huge improvement in blood pressure control, in overall well-being. People feel so much more empowered. And everyone that's in our office is very friendly, and very motivating to all of us. And that is really important, that you do this in a very comfortable environment. So we've got weights, yeah.
And you really put your action behind your words. I've never heard of a medical going to a doctor and then having the gym right there on premises. People can get there early. People could stay after their appointment.
Absolutely.
They have no reason not to.
No, anyone that wants to avail of that can come in. And rather than go into a rehab program once you've had a heart attack or once you've had something happen to you, this is a very proactive way of telling our patients, this is available for you. Please come and use it. You have access to certified personal trainers who have the knowledge. I work very closely with all of our team members and really empower them. It could be for chronic back pain. It could be for, a host of different, it's not just for diabetes or hypertension, but it's to empower you to gain your core strength, to lose weight, but also to feel really in the best shape of your life, physically, emotionally, and spiritually. All of that.
All part of lifestyle medicine.
Yeah,
all
that's
together.
Absolutely true.
You're going to be back next week, but anything else you want to squeeze in before we go?
In March, I'm going to be hosting a screening we've got 2 huge TVs in our office, and I'm going to host a screening of a movie in plant-based medicine with the concept of making this a revolution, really encouraging our patients to be more knowledgeable, to make better decisions, how to go grocery shopping, just empowering our whole community. So there's a lot more coming down the road. I want everyone to stay tuned and check us out at our practice.
I love it. Dr. Nita, thank you so much. To get in contact with Dr. Bijoor, Oakview Medical Associates is located at 11 Five Forks Plaza Court in Simpsonville, and the number on your screen right there, 627-0444. Dr. Nita, thank you so much. We'll see you next week.
Thank you.
We'll send it back to you in the studio.